may be hearing a lot these days about mpox, the disease that used to be called monkeypox.
Breaking news coming out of the World Health Organization, the WHO. It has just declared mpox to be a global public health emergency.
We thought you might have questions, so we've got some answers. It's a disease that's caused by a virus that's in the pox virus family. People who catch it feel kind of crappy. They could have a fever, they could have flu-like symptoms, but the biggest distinguishing feature of mpox is that it causes pus-filled lesions that form on the skin. If you've ever seen chickenpox, it kind of looks like that. But mpox and chickenpox don't belong to the same viral family. Mpox spreads through touching an infected animal, touching the skin of somebody who has mpox, or even touching a towel or a blanket or other bed linens that somebody who has mpox has used. Most people who catch mpox survive, but little children and people who are immunocompromised, for instance, people with HIV that is not well controlled, they can actually die from an mpox infection. So decades ago, people used to be vaccinated against something called smallpox, which is a disease that no longer exists. Smallpox and mpox are genetically close enough that the vaccination against smallpox protected against mpox. But when it was eradicated in 1980, countries started to discontinue their smallpox vaccination programs. And so in the years since, sort of 40 or 45 years, a growing population of people have essentially grown up without any protection against these viruses. The virus is found in small rodents and maybe some other animals that live in forested parts of West and Central Africa. Historically, the way the virus would infect people was that little kids would trap these animals or come in contact with them in the forest, and in handling them, they would become infected. Sometimes a child would bring the infection into his community, into his family, but those chains of transmission generally petered out fairly quickly. But a few years ago, one of the strains of mpox, and there are two strains of mpox, one of them started to spread from person to person in a sustained way, through sexual transmission.
For the moment, this is an outbreak that's concentrated among men who have sex with men, especially those with multiple sexual partners.
That outbreak was first noticed in 2022, and it spread from Nigeria into Europe, into North America, and beyond. The spread has slowed substantially from that outbreak in the last couple of years through the use of vaccines, but also because people who were at high risk modified their behavior to avoid catching mpox. But that outbreak never completely ended. In the US, there are new cases detected every week, and it's spreading in parts of Africa. Then last September, the Democratic Republic of the Congo announced that it was seeing human-to-human transmission of the other strain of the virus, which is called Clade 1, in the eastern part of the country. There it was transmitting between sex workers, their clients, and men who have sex with men. Burundi has reported quite a few cases, and Kenya, Uganda, and Rwanda have also detected cases that are linked back to that outbreak in the eastern DRC. Sweden and Thailand have each detected one case of this strain in people who traveled abroad. It hasn't yet been found in the United States. Meanwhile, there are still a lot of cases in small children in DRC, cases that are thought to have been caught the traditional way through the handling of small rodents. So as you see, there's a lot going on here. There are vaccines that can be used, but they're expensive, and the countries that need them most will have trouble paying for them. Some countries that have stockpiles of these vaccines, the United States, the European Union, and Japan, have donated some doses, but the African Center for Disease Control and Prevention estimates it's going to need about 10 million doses to try to bring this under control. Another issue is that it's not clear yet how to best use vaccine, how to make the most efficient use of the limited doses that exist. The affected countries, the donor countries, and the World Health Organization are working to try to figure that out. We're following the mpox story at STAT. You can find our work at statnews.com.